Hello, my name is Ifoma and I'm a family nurse practitioner student. I'm going to be doing a cardiovascular assessment on you today. I want you to look into the camera and tell me if it's okay for us to do it, and because it's going to be on YouTube under unlisted so my instructor can see it and grade me. Do I have your consent? Yes. Okay. Thank you very much. So I'm going to start this assessment by washing my hands with my hand sanitizer. When you walk into the office, you wash your hands. So then when doing a cardiovascular examination, you need to be standing on the patient's right side. The first thing you're going to do is to take my patient's blood pressure. So I'm going to take her blood pressure on both sides. On both arms, so that way it can be compared. I'm going to take the blood pressure while she's laying supine, and then when she's upright, sitting upright on both hands, and then it will compare the results of this. So I have verbalized that. So I'm going to go down to her neck. I'm going to assess her neck. I am going to be assessing her neck. I'm going to ask you to please turn to the other side. I'm going to be assessing the jugular vein pressure at 30 to 45 degree angle. So I'm looking at this. So what you need is a straight paper and then a ruler. So I'm using the ruler of the Seno chart. So and a ruler for you to measure it. So you start from the notch here. So I've already inspected this. So from the notch, I will use the straight paper, and then I am going to put the straight paper straight on this patient from the notch. Let me make it smaller. So I'm going to put it on the notch here. Just what you need is all a straight paper. If you can look out way there for me. Starting from where you have that bulge out where the distension shows, then you use your ruler to measure it. So with this ruler that I have right here, you will use this ruler to measure it. So for this patient, I have 2 centimeters, which is considered normal for the patient. So I will go to the next one, which is called the carotid artery. So with the carotid artery, I am going to palpate. I'm going to be palpating this patient. I'm palpating. When you're palpating, you don't want to palpate both sides at the same time. You want to do one side at a time and then the other side, because you don't want to occlude the artery that sends blood to the brain. So at this point, after palpating this patient on both sides of the artery, which is normal, there is no any lumps or any abnormalities seen, I will be auscultating the carotid artery. I'm auscultating for any broad. See. So I'm auscultating for any trail, any broad at this point. I'm auscultating right here, which there is no broad or any trail. So I will go now to the chest trunk area. I'm going to start with our usual inspection. So I'm inspecting the chest area. In a normal clinical setting, this patient chest, I will have to unbutton her clothes and see her chest wall and see what is going, see the rising and falling of the hair of the chest, looking for any abnormalities on the chest. I'll be looking at the apical impulse, and then I'll be looking at the apical impulse and then visualizing it, seeing it, and then I will also be looking at the precardial pulsation and see if there are any pulsation that are visible. In a patient that are skinny and it's easier to see those apical pulsation on this patient. So I will be going to the next part of my examination. The next part of my examination at this point, that will be palpation. So I will be palpating the point of the maxillary intensity, so which is usually on the side. So at this point, this is like the apex of the heart. It is where the cardiac impulse and can be the best place to palpate on the cardiac wall. It is also, it can also be seen in the, which is also known as the fifth intercostal space in the mid-clavicular line. So it's going to be on this side of the patient. Sometimes if you're not able to see it, you can also feel it. You can ask the patient to lay on the side, want him to lay on the side like this, just lay side. So when they lay on the side, if you're unable to see it when the patient is on the sitting position, then you're asking them to lay on the side, then have the patient lie on the left side, and then you palpate. So you are palpating for any trail, any leaves, any lift, and then you can also auscultate this area while, can you continue to lay on that side? So while I am doing that, I can also go ahead and palpate this, auscultate this area of it. I am auscultating for any leaves and any leaves. So the last one on the palpation, I'm going to palpate the you can lay on your back now. Thank you. So I'm going to palpate the aortic this, and this is above our umbilical cord. So it's right here. So I'm going to be palpating. I'm palpating for any trail, any ifs, and then I can also go down to the renal artery here. This is where our aorta is. So which branch down to the renal artery, the iliac artery, then to the femoral artery, and all this can be done while the patient is without clothes. So if it was in a clinical setting, I have to undress him because I want to feel the femoral artery right here. I want to feel all these arteries in a clinical setting. So now I'm going to go to auscultation. So in auscultation, I'm going to be auscultating this patient with both the diaphragm and the bell of my stethoscope. So the big part of it is the diaphragm, and this is the bell. So I'm going to be auscultating the aortic and the pulmonic. I'm going to be going to tricuspid. I'm going to be going to EMS area, and then I will also go to the ERBs, the ERB point. So now I'm going to start with my aortic. So, and then I am using my diaphragm stethoscope. I'm going to use my diaphragm stethoscope first, and then I will also go to the bell, listen with the bell on the aortic, which is at the second intercostal space on the right side. Then I go to the pulmonic on the left side, which is on the second intercostal space on the left side. Then I go down to my I'm going to take this put this on my neck, but under normal circumstances, this is supposed to be in the ear, but it's kind of bothering me talking while I'm explaining this. So I'm going to go to my to the tricuspid. I'm going to go to the tricuspid is on the fourth intercostal space. Then I will also go to the Meyer area, which is on the fifth intercostal space on the left side. Then I will also check the third intercostal space, which is my ERBs point. I will also listen with my stethoscope, which usually, because this is a female with the breast tissue, so it's usually around down here on the third intercostal space, which is where the ERBs point is. I will listen with my diaphragm, and then I'll listen with my bell of part of my stethoscope. So I'm going to demonstrate it again. So here with the bell, diaphragm, bell, the diaphragm, the bell, then go down to the third intercostal space, which is the ERBs point with the bell and with the diaphragm, and then the bell, and then I'm going to go down to the tricuspid, which is at the fourth intercostal space. I'm going to listen with my diaphragm and then the bell, and then I go down to the fifth intercostal space, which is the my mitral area. I'm going to listen with my bell, my diaphragm, and then my bell. So, and at this point, I'm also listening for any I'm going to be listening for any split S2 sound, and which is the split S2 sound is usually the closure of the aortic valve and the closure of the pulmonary valve, which both of them are supposed to close at the same time, but where both of them did not do that, we usually have a sound which is called the split S2 sound, and which is normal in some patients and not normal in others. So at this point, I have also described the aortic abdominal aorta. So the next thing that I'm going to be doing now is the peripheral. So I'm going to go to the peripheral of the patient. I'm going to be inspecting the peripheral part of the patient. So like every other examination, I am going to start by inspection. So I'm going to observe the patient, every extremity, the upper extremity and lower extremities. So I'm inspecting the lower extremities for any color, any warmth, any abnormalities, any edema, any varicose vein shunts. So I'm going to do the same on the lower extremities. I'm expecting for any warmth, cold, color, and varicose vein shunts and the abnormalities of swollen or edema of any kind. At this point, I want to check the capillary refill. So I press the bell of the toes, and I'm going to let it go back. It's supposed to be back in less than 3 seconds. So the same thing I do to the fingers. I press it and release it. I want it to come. It's supposed to come back in less than 3 seconds, which is what this patient did. It came back in less than 3 seconds, so she does not have any which has its normal. The capillary refill is normal. It return back in less than 3 seconds after I press it down. So I am also going to look at her renal pulse. I'm checking the renal pulse. I'm going to check both sides, comparing the pulse. I am going to be grading this pulse. At this point, her pulse is brisk, normal, and expected. It is +2 at this point. Then I'm going to check her brachial pulse. The brachial pulse on both sides, I am going to be checking both sides. I am checking where it is bilaterally equal, and it is brisk, normal, and expected, and it's +2 at this point. So I'm going to go to the femoral pulse. So the femoral pulse is here. The femoral pulse is something also that you don't need a clothes on to check in the normal clinical setting. So you're going to press here, and then you're going to feel it and also grade it at this point. So at this point, my patient has some clothes on, so I would just say it is normal. I couldn't feel it, but in the normal setting, I'll be able to feel it and be able to grade it. Then the papillar, I am going to also check this side. It is always good to use on the papillar to use 2 hands and then feel the pulse, because feel the pulse in, grade it in, and then feel the one on this other side. And also, like I said, if it's in a clinical setting, I need to take my patient's clothes off. So, but it is normal, bilateral, +2, and expected, and it's brisk. So, and then I will now go down to the dorsal pulse. So, and this, I'm going to be checking bilateral pulse, and it is normal, it is brisk, +2, and then normal. So I also this one, the tibial pulse. So the tibial pulse is right here. I'm going to be checking the tibial pulse. I'm checking it. So at this point, the tibial pulse is brisk, +2, expected, and normal. So the capillary refill, like I said, I already did that. So you're checking for any clubbing, you're checking if there's any splint or any hemorrhage, so which the TAR staining, and there is none on this patient. So everything is normal, and that brings me to the end of the cardiovascular examination today. Thank you for being my patient.